So today we will talk about the rabies. So rabies is an acute progressive viral infection of the central nervous system, and it is a zoonotic disease, which means that it is transmitted from animals to the human beings, and it is mainly transmitted to infected animal saliva. And once the clinical symptoms of rabies appear, it has 100% mortality, and it is almost invariably a fatal infectious disease. However, it is preventable by timely post-exposure prophylaxis. Next is the causative agent of rabies. So rabies is caused by rabies virus, which is a rhabdoviridae virus, belong to the genus Lyssa virus, and it is an envelope bullet-shaped single-stranded RNA virus. And it is a neurotropic virus, means that it loves to attack the neurons, and it travels to the peripheral nerves towards the central nervous system. So rabies virus is an envelope in bullet-shaped single-stranded RNA virus, and it is a neurotropic virus that travels through peripheral nerves toward the central nervous system. Next is the transmission of rabies virus. So, rabies is transmitted by the bite of an infected animal, and the infected saliva then enters the wound. The other routes include scratches contaminated with the saliva of either dog or bat, saliva contacting the mucosa or broken skin of the human being. If there is a bite of a bat, and the major reservoir for the rabies virus is the dog, and dog is responsible for majority of the human rabies causes worldwide. So actually dog is the main reservoir responsible for transmission of rabies from animal to the human beings. Next is the clinical feature of rabies. Initially, we have the prodromal symptoms in which the patient have fever, headache, malaise, anxiety, insomnia, pain, tingling, and burning at the site of the bite. Next is the neurological phase in which the patient has hydrophobia, aerophobia, dysphagia, hypersalivation, agitation and confusion, hallucinations, seizures, and autonomic instability. Then we have types of rabies. So first one is the furious rabies, in which the patient has severe agitation, hyperactivity, hydrophobia, aerophobia, hallucination, hypersalivation, and autonomic dysfunction. All of these signs and symptoms belong to the furious rabies, and most of them are neurological signs. Then we have paralytic rabies. In paralytic rabies, we have progressive weakness of the muscle occur, and there is placid paralysis occur, and the paralysis occur in ascending pattern, means that it progress from distal in toward the proximal. And if there is respiratory muscle involvement, lead to the respiratory failure, and these signs usually resemble the sign and symptoms of Guillain-Barré syndrome. So the diagnostic points in rabies include um, exposure, and that is animal exposure or the animal bite, mainly of the dog bite or the bat bite, and there are symptoms of progressive encephalitis, hydrophobia, and aerophobia. The other clues include paresthesias at the site of the bite, dysphagia, hypersalivation, altered behavior, and progressive illness. So if these signs and symptoms are present in a patient, always suspect rabies in this patient. Next is the investigations that we do for diagnosis of rabies. So we do reverse transcriptase PCR for rabies viral RNA. We also do saliva testing. We do knuckle skin biopsy for the viral antigen or the viral RNA. We also do serology for rabies neutralizing antibody. Similarly, we can also do CSF analysis, which shows lymphocyte and increase protein count, but the CSF analysis is non-specific. Similarly, we can do the postpartum brain tissue analysis, which can confirm the diagnosis. Then next is the detailed management of a rabies patient. So, in which the first and most important step is the immediate wound management. So wound management is the most important step, and in that step we immediately wash the wound with soap and running water for at least 15 minutes, and we thoroughly irrigate the wound, and then we apply antiseptic, that is a iodine or another virucidal antiseptic if available. Always avoid the irritant substances on the wound, such as applying acids, alkalis, etc. And also assess the patient for tetanus, prophylaxis, and if there is secondary bacterial infection suspected, prescribe the patient antibiotic, do proper wound care, and never wait for the symptoms before starting the post-exposure prophylaxis. The most important step in the rabies management is post-exposure prophylaxis. So after exposure to the animal bite, especially the bat bite or the dog bite, we classify the wounds into three categories. Initially, we have category 1 wound, in which no post-exposure prophylaxis is required, because in category 1 wound the skin is intact. Second one is category 2 wounds, in which we thoroughly wash the wound, and we also give the patient rabies vaccine. And category 3 wound, which are transdermal wound, we thoroughly wash the wound, we give the patient vaccine, and similarly we also give the patient rabies immunoglobulin. Category 3 wounds are the transdermal bite, are the transdermal scratches, in which the saliva exposed to the human mucosa, the broken skin, and significant exposure occur in category 3 wounds. So in category 3 wounds, we give the patient rabies immunoglobulin vaccines and proper wound washing. But in category 3, 2 wound, we only do wound washing and rabies vaccine. Next is the dosing of the rabies vaccine. So, for an unvaccinated person, uh, we mostly give four doses of the rabies vaccine, and these vaccines are given to the IM route. The first dose is given on the day of bite, then the second dose is given on day 3, third dose is given on day 7, and fourth dose is given on day 14. So, day 0, we have the day 0, day 3, day 7, and day 4 vaccines. And always give the vaccine in the deltoid muscle in adults. And smaller children, these vaccine can be given in the anterolateral thigh muscle. And never administer the rabies vaccine in the gluteal region, because the gluteal area contain high fat content. And immunocompromised patient, we can also give an additional dose according to the applicable guideline, and the additional dose is given under day 28. Similarly, along with vaccines, we can give the patient rabies immunoglobulin, and these rabies immunoglobulin are mostly given in the category 3 wounds. In a previously unvaccinated person. In vaccinated person, we do not give the rabies immunoglobulin, and these immunoglobulins are given uh, into the wound, and also into the muscle. So infiltrate the rabies immunoglobulin as much as possible into and around the wound, and the remaining immunoglobulins are given at a different site, that is intramuscular. And these immunoglobulins are given only one time, preferably at the beginning of post-exposure prophylaxis, and do not mix these immunoglobulins and vaccine in the same syringe. And rabies immunoglobulin provide immediate passive protection, until the vaccine provide active immunity. So in category 3 wound, we initially wash the wound, then we give the patient rabies immunoglobulin, and we also give the patient vaccines. And but if a person is vaccinated, then such person do not require rabies immunoglobulin. And this in a vaccinated patient, we do not give immunoglobulin, and we give only two doses of vaccine, first on the day 0 and second dose on day 3. And similarly, we also do a thorough wound washing. Once if a patient develop rabies sign and symptoms, then we admit the patient to the ICU. We maintain the airway, breathing, and circulation. And if the patient has seizure, we give the patient antiepileptics. We control the agitation and autonomic sign and symptoms. We give the patient adequate fluid and also give the patient nutritional support. And if the patient is respiratory muscle paralysis, then we provide the patient mechanical ventilation. We provide the appropriate supportive and palliative care, and there is no reliable effective treatment once clinically the rabies is established. And we give only in certain patient symptomatic treatment, and once the patient develops signs and symptoms of rabies, then its mortality is 100%. Last one is the prevention of rabies. So rabies can be prevented by vaccination of the dogs, vaccination of high-risk individual, avoid contact with stray or unfamiliar animals, prompt wound washing after exposure of the dog or bed bite, early post-exposure prophylaxis in which we give the patient rabies immunoglobulin and vaccine in unvaccinated person, but in vaccinated person we only give vaccines without wound washing. Similarly, we also uh, do public awareness to seminar and responsible ownership. All of these will prevent the spread of the rabies. So it was all about rabies and its detailed management. Thank you.